Oh, I thought so. It needs a darker green. Sorry about that. Members of the subcommittee, thank you for this opportunity to discuss our efforts to improve service to the public. When I returned to the agency, years of funding below the President's budget had undermined the hard work and dedication of our employees. This underfunding damaged our services and important stewardship activities. 2 years ago, I testified before the full Ways and Means Committee about our efforts to improve service, and I asked for your help. Congress and the administration delivered, and I thank you. We committed to fix these problems, and today I'm happy to discuss how we're using your investment very wisely to produce measurable, positive results for the American people. While we expected more claims due to aging baby boomers, the increases have been much larger than we originally anticipated. The recession has resulted in over 1 million more Americans filing claims this year over what we were projecting just 2 years ago. Nevertheless, we are improving service across the agency despite soaring workloads. In FY 2009, we reduced the hearings backlog, improved EDS quality, increased our program integrity efforts, and reduced wait times for callers to our 800 number and for visitors to our field offices. We improved our productivity by an average of 4% each year during my tenure. The combination of increased funding, new efficiencies, and hard work has allowed us to make substantial progress. We continue to drive down the hearings backlog. After a decade of steady growth, we have reduced pending hearings by over 10% in the last 15 months. We now have fewer than 700,000 cases pending for the first time since 2005. Even as we have eliminated the oldest cases first, which consumes considerably more time, we have reduced the time it takes to make the average decision by more than 3 months, from a monthly high of 532 days in August 2008 to 437 days in March of 2010. While this backlog remains our #1 priority, we know we must address our other significant workloads. Our online services are vital to serving the growing number of people who need our help. Fortunately, last year, we launched our new, easy-to-use online retirement application. Our creative marketing campaign starring Patty Duke has made this application a huge success. In FY 2009, over 30% of retirement applications were filed online, more than doubling the number from FY 2008. I would be describing a very dire situation indeed in our field offices if we did not have this new application. We now have the top 3 online services in the private and public sectors, as rated by the University of Michigan's American Customer Satisfaction Index. Later this year, we will launch our first federal online application in Spanish, the Spanish Retirement Estimator. In addition to providing better and more convenient online options, we have reduced waiting times in our field offices and on our 800 number. The average field office wait time for visitors without an appointment has dropped 15% in the last year. Last week, I approved 900 additional hires for frontline employees. These hires are going to be used primarily to serve visitors in the most stressed field offices, which is a deviation from our allocation in the past. Since FY 2008, we have reduced our 800 number wait times by 25%. In addition, we have decreased the busy rate by 30%. Our 800 number service should continue to improve with the opening of our first new teleservice center in over a decade in Jackson, Tennessee. We have maximized the hiring and overtime in the state DDSs to handle the steep increases in initial disability claims. In 4 states, we are creating teams that will assist the hardest hit states. We are also expanding our federal disability units to help those states. The recent expansion of our compassionate allowance program will help us to approve about 140,000 claims in 2 weeks or less for applicants with the most severe disabilities. Our health IT pilots in Massachusetts and Virginia have demonstrated that electronic medical records can substantially reduce disability processing times, and that's one of our great hopes for increased efficiency of the future. We used over $17 million in Recovery Act funding to expand health IT to 15 additional providers across 12 states. The President's FY 2011 budget request of $12.5 billion is essential to our continued progress. It would allow us to reduce the hearings pending by another 50,000 cases, to complete 236,000 more initial disability claims, and to increase our program integrity efforts through 31,000 additional medical CDRs. This continued support is essential to our continued progress. Thank you. I'm happy to answer any questions.